Age-related diseases rank as the top killers of Australians. A major step towards overcoming age-related diseases is first being able to measure healthy ageing, and that's what my team has done. The blood test that we've developed measures autophagy, which is the body's cellular recycling system. When the recycling system breaks down, junk accumulates, causing many of the problems that we all associate with ageing and age-related diseases like dementia.
Imagine if visceral pain impacted your every waking hour with next to no relief available. Well, that's the reality for millions of people across Australia and the world who suffer from irritable bowel syndrome, also called IBS. Now though, thanks to research from my lab, in collaboration with Ironwood Pharmaceuticals and researchers across the globe, relief is available for people with IBS, giving them back a quality of life that most of us take for granted. This discovery also unlocks potential answers for other forms of pain.
SAHMRI's heart research is embedded within clinical care to accelerate breakthroughs and deliver better health outcomes in real time. In a major breakthrough, we worked closely with industry to show for the first time that very aggressive and early lowering of cholesterol after a heart attack can reduce the risk of a repeat heart attack. Separately, our team discovered that an ancient drug used to treat gout can reduce inflammation after a heart attack. These combined discoveries add to the kit bag of treatments doctors have to manage people who have had or are at risk of having a heart attack.
The Health Policy Centre at SAHMRI has reduced the impact of chronic diseases, including heart disease, cancer and diabetes. The centre is highly collaborative, providing policymakers and health services with real-time evidence to inform decision-making. It supported Australia's world-leading plain packaging of tobacco reforms and is currently working with government on strategies to curb vaping. During the pandemic, the centre formed a dedicated COVID-19 analytics unit and informed the state's COVID-19 response, helping make South Australia one of the safest places in the world while preserving our natural way of life as much as possible.
In the basement of SAHMRI's Cheesegrater, enclosed in a 2-meter thick concrete bunker, lives a beacon of innovation and hope. SA's first and still only cyclotron, affectionately known as Matilda. Every day, we start work in the early hours to produce radiopharmaceuticals that are essential for the diagnosis and treatment of disease, in cancer therapy, neuroimaging, and more. Matilda is just one example of the world-class cutting-edge technology that SAHMRI has helped bring to South Australia. Soon, we will be home to our nation's first proton therapy unit for treatment and research, delivering the most advanced cancer treatment available for children, young adults, and people with tumors close to vulnerable organs.
The quality of aged care services received by our aging population has been the focus for some time now. The Registry of Senior Australians at SAHMRI developed an efficient, standard outcome monitoring system that uses 15 key measures to enable comparisons between aged care providers of varying sizes, case mix, and circumstances. The system has improved major national reforms for the sector, and it's now being used to improve how aged care services are delivered across the nation.
Over the past 10 years, my team and many international collaborators reinvented how we study the human brain. Using patient stem cells, we managed to reverse bioengineer tiny replicas of the human brain in a petri dish. And now we can screen thousands of drugs with these brain avatars without putting people at risk. Today, my team uses this technology to seek treatments for people with Parkinson's disease, brain cancer, and children with dementia.
Leukemia is a killer, but it needn't be. And for people with some types, like chronic myeloid leukemia, it no longer is. SAHMRI researchers have been at the forefront of global efforts to develop tyrosine kinase inhibitors that have reduced CML from a death sentence to a manageable chronic condition. CML is just one of the leukemias we're tackling. Our work doesn't just promise future breakthroughs. We work alongside of oncologists to improve outcomes for individual patients right now.
The complications of preterm birth are acute, but can also have lasting impacts throughout a person's life. My team discovered that simple, safe and readily available omega-3 supplements can play a significant role in preventing premature birth. Now, thanks to a blood test we've developed, we're identifying who most benefits from omega-3 supplementation and giving their baby the best chance of arriving on time.